guys are used to hearing, is they have more college than I do. I was not that smart and wanted to hurry up and grow up. And I was very, very young. I was 20 years old when I became a nurse, and I just wanted to start my life. So that's just the difference when you hear LPN and RN. It's just a little bit more college. I have been an LPN for 18 years next month, which makes me very, very old. I started out as a CNA, which is a certified nursing assistant, which are the people that kind of do the everyday getting ready, helping a person get ready. So they're the people that, not that I don't do it also, but they're the people that take their patients to the bathroom, they give them showers, get them ready for bed, they help them with their meals, things like that. So I started out like that. I graduated mid-semester of my senior year. So instead of waiting till June when everybody else graduated from high school, I graduated in January. And I went to work right away full-time and got my CNA and started working at a nursing home. If you guys know what a nursing home is. They also call it a long-term care facility. It's just a nicer way than saying nursing home, because nursing home sounds kind of sad and scary and kind of final to people. So that's why they say nowadays long-term care instead. I chose this career because it came very, very easy to me. I had an aunt that was a nurse, and I loved my nurse at my elementary school. I probably went in to see her every single day for something, and she was always nice to me and always treated me good. So just being around nurses and being around people in the medical field made me want to go to school to be a nurse. Plus, like I said, I already started working as a CNA, so it just came easy. Then when it came time for me to start college after high school, I decided I wanted to go to elementary education, which is what your teachers probably have, is an elementary education. And once I started, I had about a year of elementary education in college, and I decided I wanted to go back and do medical because it just came much, much easier to me. So my first year, I did use some of those classes towards my nursing degree, but the actual program that I took was 2 years to get my licensed practical nurse. And again, I wanted to grow up way too fast, and I suggest you guys don't try to grow up that fast and go to college as long as your parents will pay for you to go to college, because now you need more and more education to get higher paid jobs. So you need to go to college for a longer time now to get jobs that if you want to make more money. A typical day I am in long-term care. I work in a nursing home. I've been in a nursing home, different nursing homes for 15 years. First part of my nursing career, I worked at a place for troubled children. It's a place where they live in Couch. It's called Midwest Center. I worked there for a few years and got some background working with children there. And then I also worked for a plastic surgeon, a doctor's office, and I took a lot of sutures and staples out of people. Let's see. And then I worked in the hospital for a little while in rehab with people who have had surgery that needed to have some help getting back to do their normal everyday things. I work in a dementia unit, which is when people get older, sometimes they get forgetful. And there's a couple different ways that they call that. Sometimes you hear people say Alzheimer's. Sometimes you hear people say dementia. It's mostly the same thing. There's a little, one kind of is a little bit worse than the other one. Dementia is the one that's a little bit less. So I work in a unit at the nursing home where it's locked. So in order to get in or out of the unit to the rest of the nursing home, you have to have a code to get in. You have to hide it from the residents. In hospitals, you call them patients, but in long-term care facilities, we try to be more family-like, more home-oriented, and home-like, and so we call them residents. So that's where I work. That's where I like to work mostly. I like to work with people that have a hard time remembering what their name is, or have a hard time remembering what they're supposed to do next. sometimes they're kind of like children. Young children don't know where the bathroom is, they forget, or they don't know what to do with their sippy cup, so they just hand it to the mom or the dad. And so it's kind of similar. When you get to be old, sometimes it's just like when you were a kid. So a lot of things that I do when I come into work, I have my uniform on. I'll go over some of my tools in just a few minutes. But I have to check people's vital signs, which is how many times they're breathing a minute, how many times their heart is beating a minute. I have to check their temperatures and check their blood pressures. And like I said, I'll go over some of the tools in just a minute. And then I have to get their medications ready. Sometimes people take up to 15, 20 pills a couple of times a day. Some of them we have to hide it in food because they just won't take it from you if you just try to give it to them. Sometimes we have to say that it's maybe vitamins because they don't want us, they'll say, oh, well, I can't take that. And I'll say, oh, no, it's okay, it's vitamins. Your doctor said it was okay to take them. So although technically we're lying, it's only to make sure that they take the medicine that they need to make them feel better. Take a lot of people to the bathroom. There's 27 people to care for on that unit, and somebody's always got to go potty. So it's not much different than you guys where you're coming up saying, I have to go to the bathroom, where is it? And sometimes, we tell the same person the same thing 25 times in an 8-hour period, maybe even 50 times in an 8-hour period. But so we do a lot of that. We help feed them. Sometimes they get to a point where they forget what they're supposed to do with the food, and we have to either let them hold it and we help them do it, or we just feed them ourselves. And help. They just need constant help. They don't know how to put their clothes on. Sometimes they go days without letting us change their clothes. We have a lady right now that wears a sling on her arm because she fell and broke her arm way up here. And she always either takes the sling off and hides it in residents' rooms, other residents' rooms. It takes us hours sometimes to find that sling. Or she'll put it on and she doesn't wear it right. You're supposed to wear it and be like this. Well, she'll wear it and just let it hang. So it's just constant reminders of what they're supposed to do or what they need to do. Most of them are grandmas and grandpas, so they're old. What you would visualize picturing an old person. Some of them are young. Sometimes people get these diseases when they're very, very young. And it's sad. They still have young children, but unfortunately it can happen to anybody at any age. And the whole reason that it's locked is because they escape. They're not trying to escape. They're not trying to be bad. But they'll say, oh, well, I left my car, I need to go get it. Or my husband's out there, he's going to be looking for me. Or I have to get the bus, I have to get on the bus. We have a teacher that's on our unit, and she's always saying, school's going to start, I have to go. And we tell her, no, it's okay, we don't have school today, it was called off, or something like that. Something to reassure them, because it's a worry to them. It's a feeling that makes them feel very anxious and scared. LPNs can also work in hospitals, in schools, in wound care facilities. If people have bad wounds on them, they have to go there. Mental facilities, offices. Sometimes the people that see you in the office before you see your doctor is an LPN. Sometimes there are other things. I don't have to travel with this job. This job is in Valpo, and it's not that far from home. So I just go to work and work my 8 hours, and then I come home. But I have worked in jobs where I had to travel between different facilities, different buildings that the same company owned. The furthest away that I ever worked was in Florida, and that's when our whole family worked in Florida. I worked for a big building in Florida. I think the things that I wish I would have done, being an LPN can provide a good life. It has a lot of opportunities, but you really need to go to college for longer. If you want to do more things, make more money, and be able to kind of pick wherever you wanted to work, you need to go to college for a little bit longer. LPNs don't really get the choice, as many choices of places to work. Nursing homes of it, and Frenchie will tell you, it's very, very demanding. It's both physically demanding on your body, like my body is sore when I come home from lifting people and carrying people and pushing people, but it's also mentally very tiring, and it's hard to explain that. Say somebody comes up to you every 2 minutes for 8 hours long and asks you the same question every single time, and you've told them the same answer every time, but they don't have the ability to remember that. So it just gets very tiresome mentally, always having to reassure somebody what they're doing, over and over and over and over again. And a lot of times, like the CNAs, they don't make a lot of money. So they work really, 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 really hard, giving people showers, big people, for example. Not that there's anything wrong with it, but when you're taking care of a 400-pound person, it takes a whole lot more muscle and strength to take care of a person that big than it is a person that, say, is 100 pounds. So it's very tiring. Your body gets very tired and sore. You can also nowadays take vocational classes, which they call vocational classes, where you go to high school half a day, and then the rest of the day you're actually working, or you're working toward what you want to be. So they have classes for CNAs so the juniors and seniors, kids that are in 11th grade and 12th grade, can leave school half a day to go start working if they want to, or to go get training. Cosmetology, if you want to be a beautician, they have lots and lots of programs now that you can do through high school, and you can still be in high school and get these things done. My favorite part of the job is making the sick and elderly feel good. I had a lady that had to go to the bathroom the other day at work, and it was nighttime, and she was already in bed, and I hear somebody yelling down the hallway, and so I went in to see her, and I was off work for like 2.5 years. I stayed home with the kids for like 2.5 years. So I'm pretty fresh back at doing this, and a lot of my family has passed away in that time, and it kind of gives you a different perspective, a different way of thinking. When you hear somebody calling help and there's nobody there to help them, you really want to go and help them. So I went in there and I just helped her to the bathroom. I really didn't do much. And she said, "Oh, thank you, God sent you here to help me." And she just kept thanking me over and over and over and over again, and I just felt so gracious to be able to do something like that for her, because she didn't have anybody else to do it. Everybody else was busy, and her family's not there, and I'm able-bodied. I'm able to do things like that to help her. So it felt really, really good to be able to help her, and it was something so very simple, but to them it's huge. I always try to learn new things. My favorite part of the job is getting to put IVs in people and give people shots. I know it sounds kind of scary, but it's my favorite thing to do. I started at a really, really young age, being eager to learn more. I was 17 years old when I worked at a hospital where babies are born. It's called Labor and Delivery Unit. And I had a bunch of nurses there that were really good with me, and they were able to teach me a lot of stuff that I probably normally would not have ever been able to learn. And one of them was starting IVs and other things that I don't want to gross anybody out. But so always be eager to learn things, because people around you see that and they like it. And especially bosses, they like hearing that you're eager to do things, or you're eager to learn things, or you're not scared to go take care of something. I've been in positions in my work that I should not have been in as an LPN, but because I proved myself and because I wasn't scared to try new things, I got those jobs. It just took away time from my family. So I don't do jobs like that anymore. Just in case anybody was wondering, I know it wasn't a question that I had to answer, but depending on how often you work, LPNs can make from $40,000 to about $60,000. And that's working full time. Nursing, there's There may not be a lot of jobs for people that fix old TVs, say, but there's a lot of jobs for people to fix iPads and iPhones and things like that. Well, nursing never goes away. Nursing never gets old. People always are going to have to be taken care of. So that's not a job that's ever going to go away, and you always have a lot of options to do it. So it's a good job and it's a stable job, and you can go from different places. If you don't like that kind of job, you can go to other places and do things. Funny stories that I've heard. I have always been told that I need to keep record of it because of the things that I hear in a dementia unit. I overheard a couple of old ladies sitting at a table, just kind of chilling out. They couldn't hear each other talk, and they were just at a small table like you guys. So one said to the other, "Life is good," and the other one said, "What did she say? I can't hear her." And the other one then said, "Life is good," and that one said, "Yeah, sometimes it is, I guess." But some of the things that they say just crack me up. One lady told me the other day I was going to get a spanking if I wouldn't stop laughing at her. But she was calling me bad names, and she doesn't know what she's doing. She's not meaning to do it. But she was calling me all kinds of bad names, and I couldn't help but just laugh about it because it didn't make me angry. But it was just funny to hear those bad words coming out of a sweet little tiny itty bitty old lady with a walker that walks like this. I did make a couple of, on my computer, I did make a couple of slides to let you guys see the equipment that we need to function at work. And I just put my license. That's what, let's go too fast. Okay, well. This is a shot, of course, you guys know. That's how you give a shot. So some needles are long, some needles are short, depending on what we have to give it for. This is what nurses used to be dressed like. Used to have to wear all white. We used to have to wear a cap. We'd have to have our hair pulled back. This is what nurses wear nowadays, and this is what I'm wearing today. This is just the job where I work. This is normally what they look like. It's scary to some people to go into a nursing home because sometimes they look a little bit scary. Frenchie and her sisters are so accustomed to being in a nursing home that they're not scared about what people look like anymore when you walk in. But sometimes they look a little bit scary. This is my stethoscope. I use this to listen to lungs, heart, bellies. Sometimes we have to listen to things that are implanted in people's arms. So this is a really, really important part of work. Nowadays, we're using scanning thermometers, although we do have the ones that go in your mouth. But a lot of those people are confused and they don't want you putting something in their mouth. So they have one that it scans your forehead like this and it goes behind the ear and then it comes up with the temperature. This is, and I'm not even going to try to say it, but this is how you get people's blood pressures. They do have automatic ones. I don't like those. I'd rather take it old-fashioned because I think it's more right. It's more accurate. This goes on your finger to see how much oxygen you have in your blood. So say somebody's having a bad coughing spell or they have a lung disease, we have to put this on their fingers to see how much oxygen they have in their blood. You saw the shot, and that's just a picture of our family. Does anybody have any questions? I work at a nursing home called Valparaiso Care and Rehab. This is the company that owns it, so that's why this name is up here. Jonathan.
How did you get a chance looking at all those things that you didn't look at?
I have a secret little thing that I do, and I don't breathe through my nose when I have to do something that's gross. I breathe through my mouth so that I don't have to smell it. But it's a secret, so don't tell anybody that I do that.
You just told all of us.
But you guys won't tell. Frenchie.
Are you going to say who your favorite people are in the nursing home?
I don't really have any favorite people yet. I mean, I have a couple that I like, that it's easier to talk to them, but I don't really have any favorites yet. That's not where I work, but yes, there is one right there. Yep. Anybody else?
you gonna tell them about what the lady said when we walked into the locked part?
What'd she say? Oh, when I took Frenchie and her sister to the locked part the other day, a lady said, "Hi, welcome to our boat," because she really thought that they were on a boat.
Do you have a certain person you have to work like with?
There's a couple people that work back there, and they do a pretty good job. Yeah, it's easier to take care of somebody when you know them better, especially when they have dementia, because they need routine. Just like you guys need routine so you don't act up, they need routine too. Jonathan.
How old is the oldest person there?
I know that we have a lady that's 95, and her hair is about as dark as mine.
That's good.
Yeah, she's lucky. Anybody else?
She doesn't dye her hair.
No. Well, she can. They have a beauty shop there.
No.
But no, she doesn't dye her hair. That's just naturally her hair.
She could probably live up to 100 years.
She,
What's the most disgusting job you had to do there?
I don't do well with throw up.
Oh.
I can do poop all day, but I don't do well with throw up.
Wait, poop?
I'd rather clean up poop than throw up. Yes, friend.
Why do you like nursing?
Because I like to help people, and it makes me feel good to help people. And sometimes, not all nurses and aides take their time and go slow with people. They just kind of rush them and get them in bed, or they just rush them down the hall, or maybe they ignore them in general. And so I like to be there to help them. Yeah.
Would you ever think about your
Yes, and I have, but I'm just really good at this job. Sometimes you just find something that comes natural to you. You understand what I mean? And when it comes natural to you, it makes everything a lot easier. Shane,
What's the easiest job?
that I've done,
Yeah.
or in general?
Easiest job you've done in nursing home so far. Like for helping other people.
I used to work on a computer system that just asked questions.
No, I mean at the nursing home. What's the easiest thing?
Yeah, it was a program that they were doing to get ready to have the state come in and inspect them. And all I did was call the families and ask them questions, and I talked to the residents and asked them questions. I didn't have to do any vitals or medicine or toileting or anything. That was probably my easiest.
Have you ever had someone faint?
I've had people faint and I've had people die.
Wait, you see people in person die? That's sad.
It's very sad. But you have to be strong and you have to be there to take care of the rest of the people.
Do you know do you find how they died and all that stuff?
Well, yeah, they're usually old and sick. It's not something that is just happens. So they know it's going to happen. Well, thanks, guys.